Abdominal part of the esophagus. The abdominal part of the esophagus is only about 1.25 centimeter long. Esophageal opening of the diaphragm, internal jugular vein, subclavian, superior vena cava, hemizygous vein, accessory esophageal hemizygous vein, diaphragm, inferior vena cava 2, inferior phrenic vein, large left gastric vein, short gastric vein, portal vein, splenic vein, superior mesenteric vein, inferior mesenteric vein. Histology of the esophagus. Mucosa. It consists of the stratified squamous epithelium, non-keratinized stratified squamous epithelium. Esophagus squamous epithelium, non-keratinized stratified squamous epithelium. Lamina propria, esophageal gland, muscularis mucosa only longitudinal fiber, inner circular, outer longitudinal. Adventitia. Diaphragm, upper limb, lower limb of the phreno-esophageal ligament, cardiac notch, subhiatal fat ring, lower esophageal sphincter, zigzag line, gastroesophageal mucosal junction, gastric fold, regis. Abdominal part of the esophagus, course 1.25 cm long, enter through the esophageal opening of the diaphragm at the T10 level. Continuing with the stomach at a gastroesophageal junction. Esophageal branches of the left gastric artery, short gastric artery and thoracic aorta. Arteries supply the left gastric, short gastric and thoracic aorta. Venous drainage, left gastric, short gastric vein, portal vein, hemizygous vein, superior vena cava. Lymphatic drainage into the coeliac nodes. Innervation, parasympathetic vagus nerve, sympathetic T5, T12. Clinical site for the portocaval anastomosis, ecclesia cardia, neurological failure of the relaxation of the lower esophageal sphincter, gastroesophageal reflux disease, Barrett esophagus, hiatal hernia, and esophageal stenosis. What is this portocaval anastomosis? Ecclesia cardia is a neurological failure of the relaxation of the lower esophageal sphincter. This is ecclesia cardia. Neurological failure of the relaxation of the lower esophageal sphincter. Gastroesophageal reflux disease, Barrett esophagus, hiatal hernia, and esophageal atresia. Factor preventing esophageal reflux. Flutter valve. The abdominal part of the esophagus is a direct obliquely downward and to the left on an increase in intra-abdominal pressure. It compresses the esophageal as a flutter valve. Flap valve. The mucosal fold at the cardiac notch in the stomach wall act as a flap valve during the contractions of the stomach muscles. Phreno-esophageal ligament. It is derived from the subdiaphragmatic fascia and cross expresses to the crural muscles to the diaphragm. It has upper and lower limb. It limit upward and downward mobility of the esophagus. What is portocaval anastomosis? So, the lower end of the esophagus has a portocaval anastomosis. The lower end of the esophagus has a portocaval anastomosis. In portal hypertension, vein of the esophagus may cause esophageal varices and severe hematemesis in a portocaval anastomosis. In portal hypertension, vein of the esophagus dilated and may cause esophageal varices and severe hematemesis. It's cause a portocaval anastomosis. Esophageal varices are dilated vein at the lower end of the esophagus. It occurs in the portal hypertension more than 10 mmHg. It involves esophageal tributary of the gastric and inferior hemizygous vein. It involves esophageal tributary of the left gastric vein and inferior hemizygous vein. Left gastric vein. Esophagoscopy. Stomach. Stomach, it's called the belly. It's a muscular bag forming the widest and most distendable part of the digestive tube. Its main function is a reservoir of the food, mixture the food, produce gastric juice, produce HCl, destroy many organisms present in the food and drinks, produce abundant mucus which protect the gastric mucosa against the corrosive action of the hydrochloric acid, absorb alcohol, water, salt and few drugs, produce intrinsic factor of the castor which help in the absorption of the vitamin B12. Location is lies obliquely in the upper and left part of the abdomen, occupy the epigastric, umbilical and the left hypochondriac region. It lies upper and the left part of the abdomen, which occupy the epigastric, left hypochondrium and the umbilical region. Shape is depend on the degree of the tone of the muscles. Size is 25 centimeter long. Capacity is a very distensible organ. Its capacity is a 1 ounce 30 ml at a birth. At the puberty is 1 liter, and in adults it's 2 2 to 1 liter. In thin, tall person, its shape is a jet shape, while in broad, strong and very active person, its shape is a horizontal, 25 centimeter long, esophagus, duodenum. External features, stomach has the following presenting features: 2 orifice, cardiac orifice, pyloric orifice, 2 curvature, lesser curvature, greater curvature, 2 surface, anterior surface, posterior surface, and or a superior and inferior surface in empty stomach. External feature of the stomach: 2 orifice, cardiac orifice, pyloric orifice, 2 curvature, lesser curvature, greater curvature, 2 surface, anterior surface and posterior surface. Cardiac orifice, gastroesophageal junction, open into the esophagus 40 cm from the incisor teeth, Z-line demarcated esophagus and stomach. Pyloric orifice, open into the duodenum, thicker due to the muscular pyloric sphincter. Open into the duodenum, thicker due to the muscular pyloric sphincter. Lesser curvature, concave, Z-shape, angular, incisura. Convex cardiac notch. Greater cardiac notch. Okay. Attachment, gastrophrenic, gastrosplenic ligament and greater omentum. Anterior surface faces anterior superior related to the greater sac, and posterior surface face inferior related to the lesser sac of the peritoneal cavity. Anatomical position: hold the stomach in such a way that the stomach is flat, anterior posterior, concave, lesser curvature face to the right and convex, greater curvature face to the left and inferiorly. Two orifice, cardiac orifice, pyloric orifice, 2 curvature, 2 surface. Cardiac orifice is joined by the lower end of the esophagus. It lies behind the 7th costal cartilage. Cardiac orifice. Cardiac orifice. The cardiac orifice, its line Infantile hypertrophic pyloric stenosis is a idiopathic hypertrophy of the circular muscles of the pylorus that cause obstruction of the gastric outlet. It is treated with a pyloromyotomy, surgical division of the thickened pyloric muscles.